Are there any specific health tests recommended for breeding dogs? Breeding dogs is a responsible task that requires careful consideration and planning. As a responsible breeder, it is important to ensure that the dogs you breed are healthy and do not pass on any genetic diseases or health issues to their offspring. This is where health testing plays a crucial role. Health testing is the process of evaluating a dog's health through various tests and examinations. These tests help identify any potential health conditions or genetic disorders that a dog may have and provide valuable information for breeders to make informed decisions about breeding. When it comes to breeding dogs, there are several specific health tests that are commonly recommended. These tests can vary depending on the breed and the specific health concerns associated with that breed. However, there are some general health tests that are recommended for all breeding dogs. One of the most common tests is the hip and elbow dysplasia evaluation. Hip dysplasia is a hereditary condition that affects a dog's hip joints, causing pain, lameness, and arthritis. Elbow dysplasia, on the other hand, affects the elbow joint. Both conditions can be debilitating and significantly impact a dog's quality of life. By evaluating a dog's hips and elbows, breeders can determine whether the dog is free from dysplasia or has a mild, moderate, or severe condition. Breeding dogs with excellent hip and elbow scores can help reduce the risk of passing on these conditions to their offspring. Another important health test is the ophthalmic examination. This test evaluates a dog's eyes and is especially crucial for breeds that are prone to eye diseases such as cataracts, progressive retinal atrophy, and glaucoma. Through this examination, breeders can determine the dog's eye health and make informed decisions about breeding. Genetic testing is also highly recommended for breeding dogs. Genetic tests analyze a dog's DNA and can help identify any inherited conditions or genetic mutations that the dog may carry. These tests can provide valuable information about a dog's genetic health and the likelihood of passing on these conditions to their offspring. Common genetic tests include tests for specific mutations associated with diseases like progressive retinal atrophy, von Willebrand's disease, and various types of cancer. In addition to the specific health tests mentioned above, it is also important to ensure that breeding dogs are up to date on their vaccinations, are free from parasites, and have undergone a thorough general health examination by a veterinarian. These general health checks help ensure that the breeding dogs are in overall good health and are fit for breeding. It is important to note that while health testing can significantly reduce the risks of passing on hereditary health conditions, it does not guarantee that offspring will be completely free from any health issues. However, by conducting these tests and making informed breeding decisions, breeders can work towards producing healthier puppies that have a reduced risk of inheriting certain diseases. In conclusion, there are several specific health tests that are recommended for breeding dogs. These tests help identify potential health conditions or genetic disorders that a dog may have and assist breeders in making informed decisions about breeding. Tests such as hip and elbow evaluations, ophthalmic examinations, and genetic testing play a crucial role in ensuring the health and well-being of both the breeding dogs and their offspring. By prioritizing health testing, breeders can work towards producing healthier generations of dogs and contribute to the overall improvement of the breed.